Thank you so much for that. And thanks for having me here. I'm really excited to talk with everybody about something that is near and dear to my heart. It's the role of exercise in cancer care. So as most of us are aware, cancer is a problem. It's a pandemic that is not going away. There's more than 17 million cancer survivors in the US. And I think we're all familiar with the side effects that are found with cancer and cancer treatments. They're physical, they're psychological, they're financial. They touch every single aspect of our lives. And I'm here today to present exercise as a valid rehabilitative measure. And the one thing about exercise that is so great is that it can be introduced at any point during the cancer trajectory. So at Maple Tree Cancer Alliance, which is my organization, most of the people, in fact, 85% of the people that we work with have never exercised before their cancer diagnosis. So 85%. So if you're listening to this and you're thinking, well, I've never exercised a day in my life, well, then I'm here to tell you it's not too late to start. You can begin exercising today, and it will have a positive impact on your recovery. So Maple Tree Cancer Alliance is a nonprofit organization that I founded back in 2011. We provide free exercise training to individuals who are battling cancer at any point along the cancer trajectory. Maple Tree Cancer Alliance, what we do that is so unique is we partner with clinical settings. So right now we have 43 clinical partnerships in Ohio, Pennsylvania, California, Florida, and Brazil. We offer both an on-site and virtual model. Now, thanks to COVID, we've been able to adapt to a virtual model. But we serve thousands of patients every single year across all of these sites. And one of the things that I'm very passionate about is advocating for exercise to be a part of the standard of care in cancer. Right now, nationally, less than 2% of cancer patients exercise during cancer treatment. So I would like to see that number, of course, be much, much higher. And I'm on a mission to try to make that happen. And so let me see if I can convince you if you are not someone who regularly exercises yet. What we do at Maple Tree, everything is individualized and tailored directly to the patient. And so when you walk in through our doors, we immediately give you an initial fitness assessment. And this will tell us your strengths and your weaknesses, your likes and your dislikes, and all of the things that we need to target with regards to your exercise program. And then depending on where you are within your cancer treatment, we will categorize you into different phases. So we have phase 0, which is called a prehabilitation phase. This would be appropriate for someone from the time of their diagnosis before their cancer treatment starts. This is actually a really key window if we can get to someone during this time frame, because what this does is this will help ensure that you are as strong as you possibly can be going into your cancer treatment. That means you'll be able to withstand these treatments and the side effects from these treatments much, much better. Now, if you're beyond this phase, that's okay. There's perfectly fine. We actually just introduced this phase last year, so it's kind of new to us as well. We then put people into phase 1 who are currently in chemotherapy or radiation. From there, they progress on to phase 2, which either if they come to us in phase 2 when they've already completed their chemo and radiation, that's absolutely fine. We start you as a phase 2. Sometimes in phase 2, we have people who just didn't even need chemo or radiation. Maybe they just had surgery or hormonal therapy. Maybe they're just on a maintenance medication. From there, we progress you on to phase 3. With phase 3, you've successfully completed phase 2. You're entering remission. You're apparently healthy. And then the idea there is that we want to get you to adopt a healthy lifestyle for the rest of your life. There is a lot of research that looks at cancer and remission and exercise, and it has found that exercise does help prolong remission for particularly certain types of cancers, particularly breast cancer, colon cancer, rectal cancer, prostate cancer. There's a lot of different cancers that this has been found for. So of course, we want to get you to stay active for as long as you possibly can. Now, each one of these phases lasts about 12 weeks, give or take. Of course, prehab is usually going to be a little bit shorter than that. And sometimes chemotherapy can run really long. And, so we take it on a case-by-case basis. This is the benefit of an individualized exercise program. And what we do, as I mentioned, when you come in, initially, we give you a fitness assessment, and we also look at things like your symptom severity, your injury reports, if you have any comorbidities, we look at all of those things. We also look at quality of life and well-being. And then we measure all of those factors again with the completion of each phase. So as you progress on to the next one, and that helps guide our exercise program. It helps to show us if this is beneficial, and if it's not, how do we tweak things to make it more appropriate for you. And so in general, the components of our exercise program include that pre-screening and fitness assessment that I talked about. From there, we develop an exercise prescription, some exercise programming. The exercise programming then is just you with your exercise trainer every single week. We have enough funding for once a week in person with our exercise training, and then we give you homework to do whenever you're not with us. And then, of course, the reevaluations at the end of each phase. And then from there, once we do the reevaluations, if you choose to stay with us, then we use those reevaluations to guide the next exercise program. So we give you a new exercise program based on how far you've come in your previous phase. When it comes to designing the exercise program, or if you're watching this and you don't have a Maple Tree Cancer Alliance within your cancer center, first of all, if you don't, you can ask them for one and they'll call us. That has happened in the past. But if you don't have one and you're sitting here and you're watching this and you're thinking, well, I don't even know where to begin with regards to an exercise program, these are published guidelines right now. They were put forth by the American College of Sports Medicine, which is the governing body over exercise physiology. Essentially, what they recommend is that you do aerobic exercise between 3 and 5 days per week. Ultimately, what you want to try to get to is 150 minutes of exercise per week. And this can be walking, cycling, swimming, any type of cardiovascular exercise that's beneficial to you. That's what you want to participate in. Resistance training, you want to do anywhere from 2 to 3 days per week. Generally, we recommend 1 to 3 sets of exercises, 12 to 8 repetitions per exercise. And again, this is where it does help to be working with someone who can put you on a program, because we can identify what is a good resistance for you. Is it more appropriate for you to use those stretchy bands or a machine or just free weights? It doesn't have to be anything really fancy. And then finally, flexibility. Flexibility is the most underutilized and neglected component of fitness. And so we want to make sure that you are including flexibility. We've already heard some great tips and learned some stretches that we can do today. And ultimately, what you want to do is stretch to the point of mild discomfort. Initially, when you go into a stretch, you might feel a little bit of a pull, and that's just a protective mechanism that your muscles do. As you relax into that stretch, you'll be able to go a little bit further, but you never want to bounce. You never want to push your body beyond what it is capable of doing. And you want to hold each stretch about 10 to 30 seconds. Now, I just want to share with you some of the results that we have seen in our program. As I said, we have been in operation since 2011. We've seen thousands and thousands of patients go through our program, and we collect data just to, again, see, of course, is this beneficial? And then we also use this data to advocate for exercise becoming part of the standard of care. And this is what we have seen across the board. We have seen a 58.7% increase in quality of life on average for our patients who go through our program, an almost 76% decrease in depression, and a 48% decrease in fatigue. These three right here are the three most psychological factors that are influenced by cancer. Of course, quality of life, depression, and fatigue. Fatigue hitting about 98% of people who are battling cancer. And just as a side story, I'll share with you, I started Maple Tree in honor of my grandfather who passed away from colon cancer in 2007. And I remember he was very active and very energetic before his cancer diagnosis. But when he was diagnosed, it was almost like a light switch went off. He was so tired that there were times where he could barely get out of bed. And if you're listening to this and you are experiencing that level of fatigue, exercise is probably the last thing you want to do. And I totally understand. I remember watching my grandfather. And one of the things that I did to try to help him was I told him, you know, obviously we can't go to the gym. I mean, that's not the place for you right now. But we can get up out of bed. We can walk one lap around the downstairs of your house, and then you can go back to bed. And can you do just that? Because I think just that might help. And so we did it. He got up out of bed. We walked around the downstairs of his house one time. His house was about 1,100 square feet, so not very big. Then he went back to bed, and that was it. And he said, well, that made me feel better. Like I have more energy than what I did before. And I said, okay, well, let's wait an hour and we'll do it again. And so we waited an hour. He got up, we did the walk one more time, and he went back to bed. And just that little bit of activity really did make a difference. It gave him more energy. It improved his mood, and it helped for him to feel like he had a sense of control over what was happening to him. He didn't ask to get cancer. He didn't ask to have fatigue so bad that he couldn't leave his house, but he could make the choice to get up out of bed and walk that one lap around his downstairs of his house. And that truly did make a difference. So, you know, I know that I just gave the guidelines and I said, here's, you know, what we recommend that you do. And that might seem really far out of reach, but something is always going to be better than nothing. And so if all you're able to do today is walk around the downstairs of your house, do that. And then as you feel better tomorrow, maybe do 2 laps. The next day, maybe you try 3. You can gradually build up to these recommendations that I gave you before. So if they feel out of reach, you can take baby steps to get there. Some more evidence-based results that we have, I wanted to share with you. This is really exciting for me. These are our phase 1 patients who have gone through our program. This is data from more than 3,500 people as they've gone through cancer treatment. So in chemotherapy, we have seen an increase of 15% in cardiovascular endurance, 18% increase in muscular strength, 5% increase in muscular strength, and then a 32% increase in flexibility. These people are getting stronger during chemotherapy. When you think of chemotherapy and all of the toll that it takes on your body, and then you see results like this, I think that this should give you some hope that you can make something positive come out of such a hard illness that you're in. Of course, you're going to have bad days, and cancer is cancer. I mean, it still took the life of my grandfather, but we have seen even in terminal patients that their energy has improved, and you know, they want to continue exercising for as long as they possibly can because it does make them feel so much better. Financially, if you are overwhelmed with medical bills, as I know comes with cancer treatment, one of the things that we have looked at is if you exercise during cancer treatment, does that impact your healthcare utilization? And we have now published 2 studies looking at this in peer-reviewed data. And what we have found is that healthcare utilization actually decreases in people who exercise compared to people who do not exercise. We found a 6% decrease in inpatient hospital stays, a 19% decrease in length of hospital stay, 27% decrease in ER visits, a 33% decrease in total patient encounters, and a 47% decrease in 30-day readmissions. On average, patients who exercised compared to patients who didn't saw in that first 6 months of exercise an almost $4,000 reduction in their medical costs compared to those who didn't. And so financially, it does help as well. And then I just wanted to close with how you can get involved. If you're a patient watching this and we are not yet serving where you are, I would encourage you to ask your physician for a Maple Tree program. Since the beginning of 2021, I have received 2 calls from 2 different hospital networks we are not yet serving because their patients asked for a maple tree. And so they called us and now they want to partner with us. Also, take a walk. It's a little cold outside today, I'll give you that, but you can walk around the inside of your house, and maybe if you have stairs, go up and down your stairs a few times. I promise you will feel better. You can follow us on Facebook and Instagram. Every weekday morning at 9 a.m., we do a movement of the day where we teach you an exercise that you can do in the comfort of your own home with zero or very minimal equipment. And so, you can definitely check that out. It's Maple Tree Cancer Alliance for both of them. And then also join our email list. We have monthly challenges and monthly education that we give. Next month in February, it will be a focus on flexibility training, and we'll walk you through some stretches that you can do. So we're here to serve you and to get you moving. So anyway, that concludes my presentation. I'm happy to answer questions if there's time.